Hi there, and thanks for joining us. I'm Wealthy Jenner. Those with congestive heart failure are often in and out of hospitals and sometimes go through multiple open heart surgeries. This was the case for 80-year-old Jerry Owens until Dr. Sindrani at Community Regional Medical Center introduced CardioMEMS, a wireless monitor that's been proven to significantly reduce hospitalizations for heart failure patients.
We try and find the one which is closest to the left side of the heart, so then we can know exactly what is the pressure in the main pump of the heart and how it's affecting the fluid status in the lungs.
Jerry Owens has been Dr. Sindrani's patient for about 15 years. Before getting the implant, he had open heart surgery, was taking multiple medications, and doing extensive testing nightly. His wife Elizabeth couldn't be more grateful for CardioMEMS and the relief it's given them.
The CardioMEMS is wonderful because it tells the doctor if something is wrong prior to his body even responding to something going wrong. And so the doctor knows what's wrong before we do. And it's a big help to them to catch things early and not wait until he has to go into the hospital. Prior to that, we had a lot of work to do in the evening. We had to go through a whole process of testing with his, it doesn't sound like a lot when I just speak it, but it's every night, and that gets really hard. For 6 years, it
had to take my weight, temperature, the whole bit, just, every
blood pressure, take an INR, do a lot of things every night, and that got old. And the CardioMEMS stopped that.
It's the first and only FDA-approved wireless heart failure monitor, developed with the belief that on-demand, real-time monitoring enables proactive patient management, leading to fewer hospitalizations, improved quality of life, and more efficient, cost-effective health care.
The key to this is to really, essentially this is the device helping us in patients who keep coming back in the heart, in the hospital with congestive heart failure. That means their lungs are filled with water. So it is really helping us in figuring out the patients with really bad hearts of when to intervene on them for advanced heart failure therapies like a heart pump or a heart transplant, depending on the patient's perspective or patient's condition. They will be, so it's avoiding us to have them less admitted in the hospital.
Community Regional implemented the system in 2019, and Dr. Sindrani says the advanced technology can catch heart failure symptoms 10 to 14 days before a patient begins noticing them, allowing patients to go about their normal lives while being monitored. So how exactly does it work? All patients have to do is lie on an electronic pillow for a few minutes daily, and the results are automatically sent over to specialists.
Everything else would be transmitted through their pillow to you the next day or when they're at their home. So this device does not have any batteries. It just oscillates at a particular frequency, and that oscillation, there's got little loops in it and a little small plate stuff in the middle where these loops have to be right in the blood vessel, where it would oscillate at a frequency where it would match, it would resonate what the pressure would be in the heart.
It works really, really nice, and I feel a lot better since I've had it installed. And I enjoy talking to my pillow.